Hello and welcome to Shopping East Tennessee on WTMB. I'm Joe Palo, and we're here today at Tennessee Valley Bone and Joint, located on North Ocoee Street. The physical address, 2350 North Ocoee Street, 476-5554 is the phone number. And I'm here with Dr. Matthew McCartney of Tennessee Valley Bone and Joint. And Dr. McCartney, thank you so much for being with us today.
Thanks for having me, Joe. Appreciate it.
If you will, the folks watching, tell us a little bit about yourself.
Okay, Joe, I'm a chiropractor here at Tennessee Valley Bone and Joint. I graduated from University of Tennessee back in 1998. I went into a orthopedic career doing device sales, and it allowed me to get a good feel and a good knowledge base for the anatomy of the body, and did that for 7 years out of Chattanooga and loved the Cleveland area and wanted to come back to the area. And so I decided to go to chiropractic school. I had a life-changing event that kind of led me to chiropractic, and really I was friends with Dr. Ricky Hutchison for over 12 years now. And when I graduated from school, he invited me to come back and join his practice.
Great. And a lot of folks may know Dr. Richie Hutchinson, just a wonderful physician here in town. So are you a Knoxville native?
I am. I went to Carnes High School in Knoxville. I used to compete with all of the local high schools in the area and played football, basketball, and I wrestled. So very familiar with the Cleveland heritage, their sports heritage. It's a phenomenal place to be.
Well, speaking of heritage, this has nothing to do with what we're talking about, but I'm a big Dolphin fan. Chad Pennington is one of our quarterbacks. Now, did he not go to Knoxville Carnes?
He did not.
Knox West or somewhere?
Yeah, now Knox West, yeah.
Okay.
That's right.
Okay.
That's right.
But anyway, we digress. Larry Zonka.
Yeah, you don't look anything like that.
Well, I look different on television with the equipment on. Okay, well, let's talk about chiropractic care, because I know a lot of folks out there are interested in some of the pains that they may have, thinking that, how can I alleviate this? And a lot of them don't realize pain can be alleviated with some chiropractic care. Why do people, I guess for the pain, what I just mentioned, but other reasons, why do people seek out chiropractic care?
I would say the most common reason people seek out chiropractic care is they want to take an alternative way of treating their aches, pains, or whatever it might be, as opposed to modern medicine, if you will. There's nothing wrong with modern medicine, but at the same time, if we can address some of the pains and aches and pains without using some of that modern medicine, then it's definitely beneficial to the patient with no side effects and so on and so forth. But all kinds of different things can be helped with chiropractic care. Low back pain, headaches, neck pain are just some of the most common. But the reason I became a chiropractor was because I had allergies, and I saw a chiropractor, and my allergies went away for about a year and a half. So there's a lot of different reasons, and chiropractic as a profession is so new in the grand scheme of things, and the research is so limited right now that we really don't know all of the benefits of chiropractic.
And I don't think people watching really do. I had the same kind of a situation. I had sciatic nerve problem. I didn't go to the chiropractor at first. Went to a emergency room. Mm-hmm. They gave me some painkillers. They gave me some muscle relaxers. A week later, it's still hurting. They wouldn't give me any more. So I went to another doctor who gave me some more. Yeah. After the second week of doses with nothing, I thought, I'm going to go to a chiropractor. I did. 3 days, folks. It was gone, completely gone. And I totally believe in it. And I think folks out there don't realize what you just mentioned too, headaches. Some people just live with headaches constantly, and they do not realize that a visit to the chiropractor might eliminate those.
One of the most common headaches out there is a headache called cervicogenic headaches. And that just means genic is the root word meaning comes from, and then cervical spine. So it's basically a headache that comes from your neck. And so if there's joint dysfunction in the area, or if there's a disc, or if you have nerve impingement, or if you had some of those things, lots of times that pain will travel up and into the head and cause a headache. So
now, headaches, of course, everybody gets them, and doesn't matter the age. What age groups do you work on? I know we know adults and I guess children, but we were talking before we went on air. Infants as well.
Most definitely. There is no age that's not right for chiropractic.
Okay.
If we're talking about infants, they can be treated, and there's a great study out there that shows that through chiropractic adjustments, ear infections, in pediatric ear infections, can be lowered just by getting adjusted. Really? There's numerous studies out there that show, your teenage to your middle age years, your professional athletes, the athletic enhancement, the rehab, the lessening of rehab time, all of these things. There's not a professional athlete out there that doesn't have a chiropractor. Mm-hmm. So it makes you ask the question, why is it okay for them and not okay for me? Why does it work for them and not for me? It will work for you. It will work for everyone.
And I guess another question folks may have is, will my insurance pay for this?
Most definitely. That's a very common question, and we kind of address it two ways. One is that we're on all of the major insurance provider or insurance carriers, their provider list. So if your insurance benefit has a chiropractic benefit, then yes, it will cover it. For patients that A, don't have any insurance, or B, don't have a chiropractic benefit, we do a very, very economical rate here at Tennessee Valley Bone and Joint, and we're going to, for this show, we're going to do an introductory rate for $30 a visit.
Okay, great deal.
Thanks.
Now, that's okay. $30 a visit. Right. What do they need to do? I mean, make an appointment, walk in off the street. What would they need to do to get to see you?
It's better for everyone if they make an appointment, because then they don't have to wait.
Okay.
But we will take walk-ins, but we prefer them to make appointments. But the easiest way is just to call 476-5554 and schedule an appointment. I have openings. I'm here 5 days a week. And I'm usually here from 8:30 to 6 p.m. And that way we can make arrangements for pay people that have to work.
Right.
So,
right. Well, what would an average visit to you consist of?
Initially, it would consist of a physical exam. I would examine the entire body, focusing on the key areas of complaint. We may or may not do X-rays. It just really depends on the specific case, and then the adjustment. And so the adjustment would consist of, we kind of talked before the show, it would consist of manipulating the spine so that your range of motion is better, mm-hmm. and targeting the key areas where people hurt. Right.
Again, another misnomer. People, if you go to a chiropractor, he's going to have you come back and back and back and back, and that's not true. So, kind of ballpark, what can someone expect about how many trips, how many visits before they start getting some relief?
That's kind of the beauty, Joe, of what I do, because I use a technique that has a care plan listed and labeled out for us. We know that if you come in and I make you rate your pain on a scale of 10, 10 being the worst pain you've ever felt, 0 being no pain. And I make you tell me, okay, what is your pain today? So in a mock visit, you might come in and say, my pain's a 10 out of 10 today. Well, my care plan for you would be 3 visits a week based on that 10 out of 10.
Okay.
But what happens is that after the first visit, you may all of a sudden be a 3. That puts you in a 1 time a week category.
Okay.
So as far as a patient who is afraid of being told they need to come for 150 visits, that doesn't happen here.
Right.
So we try to get patients better, faster, and out the door.
And for folks that have not been to a chiropractor before, does visiting a chiropractor, the treatment that you do, does it hurt?
The easiest way to answer that is that I'm just going to use this model real quick.
Sure.
In the spine, we have these joints in the back, and that's usually the joints that are being manipulated. You can kind of see them moving there. When we have nerve impingement or we have these misalignments that cause problems to our nervous system, 9 times out of 10, our muscles that are in our back, everybody knows the 2 muscles that run down the back, right down the back there, they'll go into spasm. And what happens is that then those muscles will actually close down the joint even more and will hold that joint in place. Now in some cases, that patient might have those joints stuck in that position for 30 years. Okay. And now they come into me and I move that joint. So yes, it could be tender, but what I always tell patients is if they'll get on a strict icing regimen, which is one of the things that I am very firm about here at the office, is all of my patients leave and they leave with an ice pack and they leave with a strict regimen of how to ice. And if they just increase their fluids, then I get a lot more, wow, this feels amazing, than I do, wow, that hurt. So to say there would be no pain at all, I can't say that, but the people who are afraid, I can promise you it's not as bad as you think.
The relief is the best part.
Usually the tenderness that you have from the adjustment is far outweighed by the relief you have from the problem you came to see me with originally. So,
well, let's also tell folks, because there's so much information we can get in here. You do sports medicine.
We do.
You are a chiropractor working with the local middle schools right now, and you also work with mixed martial arts teams.
I do.
So sports medicine is a big part of this. So I know you deal with a lot of athletes and you help them as well.
Most definitely. It's kind of what we were talking about earlier as far as there's not a professional athlete out there without a chiropractor. It just helps healing so much. If a kicker has a limited range of motion in his hip when he goes to kick the ball, and I can adjust him and give him a couple more inches, he's going to kick that ball further.
Yep.
And so that's the way to think about it as far as sports medicine goes. Also, like mixed martial arts, if a guy can take his leg and put it behind his head, then he's a lot less likely to be caught in a move that will hurt him, and so he'll be a better athlete because of it. So that's as far as sports medicine goes. I was an athlete all growing up, and just love it. So this area is great for me to come and give back to the community in that area. So.
Well, let's also talk real quick, because I know you all have a website and a blog. Tell us about that.
We just recently started a blog, but the website is www.tnbonejoint.com. And so if you click through the tabs, there's a chiropractic care tab, and then you can see there'll be some testimonials, and there'll also be Dr. Matt's blog. And that will link you to my blog, which every 2 weeks I update on a different condition that the research has shown chiropractic helps with. So, and I also take suggestions. So if you're sitting at home and you have neck pain or you have sciatic nerve problem, then feel free to jot down there that you'd like to see some of the chiropractic research on sciatic nerve pain, and I'll do the research for you and put it on the blog.
Well, folks, of course, we've been talking today with Dr. Matthew McCartney of Tennessee Valley Bone and Joint, located again 2350 North Ocoee Street here in Cleveland, right off of North Ocoee Street, obviously. 476-5554 is the phone number to make an appointment, get an appointment in to see Dr. McCartney. And again, all ages, infants, children, adults, everyone can be helped with chiropractic care if it's done correctly, and of course if it's done in the right fashion, which obviously from hearing what Dr. McCartney spoke of, he knows what to do. Again, the website, Dr. McCartney?
www.tnbonejoint.com.
Okay. Again, 2350 North Ocoee, 476-5554. Thank you for being with us today.
Thanks for having me.
And don't forget, give them a call and come by here and see these folks. Great place, beautiful, beautiful building, and of course they'll help you out. It's Dr. Matthew McCartney. It's Tennessee Valley Bone and Joint on North Ocoee, 476-5554. For Shopping East Tennessee on WTMB, I'm Joe Palo.